Hi, my name is Olivia Poe, and today my presentation is on syphilis. Treponema pallidum is a gram-negative bacteria that causes syphilis. It is shaped like a corkscrew, or what some of us know as a spirochete. Treponema pallidum has a cell wall that is made of a thin layer of peptidoglycan. This structure gives the bacteria shape and surrounds the plasma membrane. Being gram-negative, we understand that this layer is very, very thin. We also know that this bacteria multiplies by binary fission. And this picture is a slide of what it looks like when we use a microscope. You can see the kind of corkscrew or spirochete shape and the fact that it is pink or red is gram-negative. Syphilis is contracted by either bodily fluids, skin, or mucous membranes. Treponema pallidum is spread only through human contact or certain other ways, so we'll talk about those on the next slide. And oftentimes when people carry this disease, they're sheltering the pathogen that they don't even know that they have and spreading it to others without even noticing. This pathogen also lives on the outside of the human body, whether it be our genitalia or our hands. To contract syphilis, it is transmitted oftentimes through sexual interaction, anal, oral, or vaginal, but sometimes we see in certain circumstances, we see that with contact of needles that you can get syphilis or a skin lesion. Syphilis occurs in 3 different stages. It occurs in primary, secondary, and tertiary. In primary stage, we see that there's an ulcer that can occur sometimes on usually the genitalia, and it comes and goes just depending. It'll happen within the first, I feel like 6 weeks of contracting syphilis. And with secondary stage is post 12 weeks, and it can form. You can still get the same like ulcers or lesions, or it can form a rash on the body. With tertiary stage, it is with a year of contracting syphilis, and it can last for years and have reoccurrences of the prior phases, and eventually, if not treated, will occur in cardiovascular or neurovascular syphilis. The best way to prevent syphilis, I feel like, is pretty obvious. It is to stay abstinent from sexual activity or not share needles with other people. To treat syphilis, there will often be a blood test to be done to see if one has it, and it can be cured with certain antibiotics. But if there's a lot of, if you wait a couple of years and there's prior damage, it will not fix that. Most times when you get treated for this, you will take the antibiotic specifically called penicillin. And interesting facts that I have, I think we've all heard of this one, and it was rumored that Adolf Hitler had neurovascular syphilis, and so that's what their reasoning for his craziness. But other people that we may know that I thought were interesting were Henry VIII, Shakespeare, and Abraham Lincoln. And I also try to find where syphilis first broke out, or the first outbreak of syphilis was, and that was in Europe. And there are a couple different theories whether Christopher Columbus brought it over, but nobody really can prove it for sure. And so these are some of my citations, and thank you for watching. Thanks.